Hi, everyone. Thank you for that introduction. So today I'll be presenting to you the impact of a lifestyle intervention on pregnancy and postpartum cardiovascular and insulin resistance biomarkers among at-risk Latinas. There we go. So among women with abnormal glucose tolerance during pregnancy, there's an elevated risk for the development of type 2 diabetes and cardiovascular disease. Now, Latinas experience higher rates of both of these conditions compared to non-Latina whites. However, prior pregnancy and postpartum insulin resistance and cardiovascular biomarker trials have been largely limited to non-Latina white women, have required travel to a gym, and did not utilize a theoretical framework. Now, this led us to evaluate the effect of a lifestyle intervention on pregnancy and postpartum insulin resistance and cardiovascular disease biomarkers among at-risk Latinas who screened positive for abnormal glucose tolerance. So this was conducted within Estudio Parto, which was a randomized control trial from January 2013 to December 2017. This was conducted among postpartum Latina women who screened positive for abnormal glucose tolerance in Western Mass. And the goal of the study was to lose 1 to 2 pounds per week via physical activity and dietary modifications. Now, this was conducted using culturally and linguistically modified and individually tailored lifestyle interventions. And so here, out of the women who were eligible to participate in the study, 204 were randomized during late pregnancy, 100 into the lifestyle intervention, and 104 into the health and wellness comparison group. Now, after delivery, these women receive face-to-face mail and phone contacts with study personnel at 6 weeks postpartum, 6 months, and 12 months postpartum, and surrounding each of those time points. We collected fasting blood to measure total cholesterol, LDL cholesterol, HDL cholesterol, triglycerides, blood glucose and insulin, and HbA1c at each of the assessment time points. Now here we're looking at the difference in percent change of the biomarkers from late pregnancy to 6 weeks, 6 months, and 12 months postpartum. Important to note is at baseline, there were no significant differences in the biomarker levels between the intervention groups, but we do see a significantly greater reduction in insulin and HDL cholesterol among the lifestyle intervention group compared to the health and wellness group at 6 weeks and 12 months postpartum. When we look at these between arm changes between these two significant biomarkers, this is incorporating all the time points. And so we see that there's a statistically significant negative 4.32 milligram per deciliter decrease in HDL cholesterol from late pregnancy through 12 months postpartum. And this is among the lifestyle intervention group compared to the health and wellness group. We also observed a borderline significant negative 4.25 micro international unit per milliliter decrease in blood insulin levels from late pregnancy to 12 months postpartum among the lifestyle intervention compared to the health and wellness group.
1 minute.
So overall, we see that there are decreases in blood insulin and HDL cholesterol levels. And these reductions could be due to overall reductions in weight and total cholesterol that was observed among the lifestyle intervention group, but could also be due to multiple comparisons. And it's important to note that there was no difference in total and LDL cholesterol, triglycerides, blood glucose, or HbA1c. So the main limitation of this study was the loss to follow-up. We did have 36% attrition between randomization and 6 weeks postpartum. And this is likely due to the burden of caring for a newborn baby, the fatigue associated with that, as well as work-related obstacles, which have all been identified in this and other trials as major barriers to participating in a study, as well as maintaining an active lifestyle. So in conclusion, the findings suggest that a lifestyle intervention may have a beneficial impact on blood insulin and a detrimental impact on HDL cholesterol, but requires replication in larger studies. And I'd just like to acknowledge all of the co-authors for their work on this, and of course, all the participants of the Studio Parto.
Great, thank you, Katie. It's open for questions.
Yes, thank you, Katie. So your first question is, how did the addition of a theoretical framework compare to prior studies? Contribute to the results and interpretation of your analysis?
Absolutely. So the theoretical framework we used both the social cognitive theory and the trans-theoretical model. And both of these have been tested among this subgroup of women, of Latinas, and have helped in building the lifestyle intervention. And so with the use of those theoretical models, they're more able to incorporate important aspects of a lifestyle intervention and the way that you deliver that information to try and help really make the intervention stick. Per se. So they incorporate greater social support, interaction with others, and multiple different types of like self-efficacy support.
Okay. How did you culturally tailor these interventions for postpartum Latinx women?
So these were culturally tailored first they're both culturally and linguistically tailored. And so these are kind of a combination. So we had all of the study personnel spoke Spanish, and we made sure that all of the promotions for increasing your activity, as well as the dietary recommendations that were discussed in the individual counseling sessions as part of the lifestyle intervention. These were made so that they were more applicable for women who ate, say, a culturally specific diet.
Can you please discuss how lactational status influences these measures, both within individuals who may have been nursing early in the study, but most are weaned 12 months postpartum, as well as between individuals at each of these stages of evaluation?
So that's a great question. And I am not sure how breastfeeding status would affect the biomarkers themselves. And the second part of that question was regarding?
As well as between individuals at each of these stages of evaluation.
So between individuals, I'm not quite sure what that is referring to, whether they're changing their, like from 6 weeks to 6 months to 12 months, whether they're changing their breastfeeding status. But one of the things I can speak to regarding breastfeeding is that none of the women had significant differences in breastfeeding between the two intervention groups at any of the time points. So either way, I don't think that would affect the results.
Okay. To what degree do different social networks play a role in diet and your health endpoints?
So the social networks, this is related to the social support given by the study personnel. So when you have the supports and the familial support that they encouraged in the participants, this is more likely to have women continue with the study, but also continue with their physical activity as well as their diet. This really motivates women, and we try to use pregnancy here as a teachable moment so that women who are becoming pregnant and then having their baby, they're seeing this as they're bettering their own health so that they can better take care of their baby, but also for themselves. And it's a really transformative time in their life. And so using this as a way to gain greater social support to help them further their healthy lifestyle is a core foundational idea of the intervention.
We have a little less than a minute left, so maybe one last quick question.
How did you deal with the loss to follow-up in your analysis?
Yes, so the loss to follow-up, we are anticipating using multiple imputation. We would also like to look at this across a larger time span. So those are some ideas for how we may handle that particular issue.
Okay, great, thank you. That was